Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery. Welcome to Hot Takes, and I'm very pleased that I have a good friend of ours here with us today, and this is Leslie Bonci. She is a world-renowned dietitian, and she speaks all over the world, and she has helped two football teams, one in this city, the Pittsburgh Steelers, and she has helped the Kansas City Chiefs win several Super Bowls, and she's worked with other professional teams, professional athletes. And she is part of our semaglutide program, where our patients get to talk to her, start really learning how to change their eating habits, their lifestyle. And as you know, in the hot takes, I love this because we have patients that send in questions and videos from TikTok and Instagram and ask us, is this real? And so I really have a lot of fun with this. We've looked at some videos. There's some good ones and some funny ones. So I want Leslie's perspective as somebody who can help us weed through some of this. Is this real? Is this not? And if it is real, how do we go about it? How do we implement that? Because again, we can lose weight in many ways and they're all effective. Gastric bypass, gastric sleeve, diet and exercise, and now with the semaglutides, they're all terrific. But you have to change your lifestyle. You have to move. You can't just, take the medication, have the surgery. Those are tools to help us control what we do, but eating and what we take in has to be accounted for. So welcome. I think this is going to be a lot of fun. I've been waiting to do this with you for a while. So you helped me and my son Gino years ago when he was playing hockey sort of get an idea of what's real and what's not real. And so let's just start it off. I think the biggest one is I want you to address a lot of patients that are having a lot of success with semaglutides. And the first video is a young woman talking about what I think is great is that just because you're losing weight doesn't mean you're healthy. Those are not synonymous terms. And I see that with my patients, but give that advice. So especially when patients are not eating, they have no appetite, what do they need to do?
So what we start out with this is that number on a scale. That's always been the benchmark. Okay, if it's lower, then I'm good. If it didn't change or went up, then I'm bad. That's the way it's been. But we really need to look beyond that because what is that number telling us, first of all? Well, some of that could be losing water. Maybe we peed more that day. Some of that, unfortunately, could be muscle, and that's really non-negotiable. We don't want that to happen. And some of it could be body fat. So I'm really looking at the gains. What are you gaining as a result of this? I'm gaining a better awareness of when I'm hungry and when I'm not. I'm really being able to take the time to eat because I'm not so ravenous that I have to shovel food into my face. I'm able to sit and chew and savor and allow my body to get used to a new way of eating and a new routine. And that doesn't happen overnight. That happens over a period of time, but that's kind of the plus one instead of the, oh no. And even if we don't see that number changing on a scale, I feel so much better. I feel more in control, not controlled by or not out of control. And that to me is a win each and every time.
Right. And I think the biggest thing you hit is when you pick that number, it has to be a realistic number. And so I usually ask patients, why that number? What is it about that number that's significant? And a lot of times it's a number that was them 20 or 30 years ago, and you're not that same person. And men and women, but especially if women have been through pregnancies and everything else, it's really hard to hit that number. And so as we were talking before, we want patients to be set up for positive wins all the time. And when you start off with a number on a scale that is unrealistic, you set yourself up for failure. And we've all failed diets our whole life. And so it's just another failure. And that it's implanted in our brain that we failed again, and then we go back to our old ways. And so hopefully with this, we'll talk about some things to help patients maximize their positives and minimize their setbacks. And the other thing that this young lady talks about is all these diets, they're not sustainable. And so what you teach is, how do we change how you eat? What do you like to eat? So go ahead and kind of go through that because you went through that with us. And I thought it was fascinating how you talked to my younger son through how he looks at food.
So the first things we're looking, it has to be attainable and then maintainable and sustainable. All three of those are really important. But as a registered dietitian, I need to listen to learn. How do I know what you like to eat? If we're sitting down and having a coffee, here's a piece of paper, just eat this. What if you hate tuna fish? What if you're deathly allergic to it? And that's not smart. So I ask questions, and the least of what I'm interested in is the food. What I'm really interested in is the patterns. How do you eat over the course of the day? When are you most hungry during the day? What does your fluid intake look like? Do you eat differently on the weekend than you do during the week? I work with a lot of people that are active. What do you do with your eating around the time that you're physically active? Does your family eat together, or do you eat by yourself? That's very nosy, but I have to know that so that then I can help somebody better plan. I always ask people what their favorite foods are, because 100% of the time, if people are trying to lose weight, I can't eat that anymore. And there's this little voice like, okay, I love those foods. Never again can I have an Oreo. No, that's not what we're talking about. Do I need to know what those are so we can figure out how to work those in? And at the same time, what somebody doesn't like, because I would not be doing my due diligence if I gave somebody the list of foods that they absolutely cannot stand. So even back to the favorite food, if somebody says, okay, it's a glass of wine. Yes. Or it's the Oreos, or it's the whatever. Well, but I have potato or rice or pasta, but which one would you prefer to have? Maybe not both at the same time. There is the negotiation. And we have to have negotiation because that gets the patient involved. And that's the way that I'm going to gain trust. I heard what you said, and I'm going to factor that into the plan rather than issuing you ultimatums that we do for 24 hours. Right. Oh, and out and say, I'm not going to do that anymore.
Right. Well, we were talking about before some of these diets, paleo, keto, and they're just not sustainable. There's no way you can eat like that for your whole life. So with that in mind, touch on intermittent fasting, because that was really big. I think people still like it, but it sort of seems to fall out of favor now. But talk to us about that.
Yeah. So when we talk about intermittent fasting, or sometimes people refer to that as time-restricted eating. So in general, as the category, we're looking for more hours of the day where somebody is not eating versus the number of hours if they do eat. So some people try and follow a plan like 16-8, 16 hours fasted, 8 hours eating. Some people will eat normally one day and then do the restriction the next day. So the issue with this, when you look at the studies, is comparing somebody who's doing intermittent or fasting or time-restricted eating with some other way of reducing calories. It's the same outcome. It's not better at losing body weight or decreasing body fat. But the issues with this is that it doesn't always change what you eat. So if you weren't eating well to begin with, now you're just doing that in shorter hours of the day. Right. But it doesn't really move the needle towards health. I have found that for my patients that have tried it, those that are most successful with it are those who maybe eat very little during the day, and then once they get home, all bets are off. The refrigerator opens and it's one continuous shovel until they go to bed. Right. So for those individuals, if they then allocate a time, I won't eat after 8 o'clock at night, then they are eliminating some of the excess. But the other side of that equation is, if you don't change what's happening earlier in the day, you're going to continue to eat late at night because your body's hungry. So it's not just the hours, it's the entire day that we need to look at. The other issue I have with this is because the way that the body tends to build muscle over the day, so we're more preservation than breakdown, it's not typically starve and then eat. That's really not what the body likes, and that's more what people do, or it's impractical time. I'll eat at 9 o'clock in the morning and I'll finish at 3. Oh, but my family's sitting down to eat at 6. So I'll sit there and rub my fingers on the table. It's disturbing. That smells good. It's just not the same thing. So it has to be practical. How does it fit into your family life? And if you are going to do it, I think before that, figure out, are there certain times of the day that you tend to overdo with eating? And let's work on those. Let's work on the weaknesses, things that you're already doing right. Why would you change them? It doesn't make sense to do that.
Right. And I think that's important, is that you have to put that in, because I can tell you as a physician and a surgeon, I'll go hours and hours and hours without anything, no water, nothing, because I'm in surgery, or I'm seeing patients all day long and I don't eat. And then when I would get home, it was like everything looked good. And carbohydrates was the best because it hits you the fastest. And so you just can't, you have to change the way you look at that. And that's the one thing that you taught us, to kind of change how you view that. You can still have some things, but it's almost like a bank account as well. You want 2 things, but your bank account can only, you can only buy one. So which one would you
choose?
Right. Because you can't have both. And so I think that helped me also. I was looking at it from the dollars and cents. So there's some other things that patients were talking about. And one of them that caught my eye, because there's so many supplements now. Everybody, vitamins and GNC and everything, they're $1 billion industry, because everybody has their take. Everybody has the best of this, that kind of vitamin. And I've said in the past that, if you are taking in enough vitamins and you're a young, healthy person, you don't need a lot of supplementary vitamins. Now, if you're deficient or you're going through an extreme time or you've had surgery where there's stress on the body and things like that, yes, then you may benefit from that, but you really just don't know what you need. There are blood draws or different ways of figuring out what you need. So just taking multivitamins doesn't always benefit people. One of the things that has been out there for a number of years now, we know about fish oil, omega-3s. We know there's a lot of benefits. But geez, you walk into a pharmacy, you walk into your grocery store, and there are 35 different types of fish oils. So talking about fish oils, and how do you go through, meandering through these stores, picking out good vitamins, good supplements? What are you looking for? Because I wouldn't know. I mean, I wouldn't know which fish oil is better than another, and they're not all the same. And so
they are not all the same. And I think, first of all, it's kind of the fish oil primer, so to speak. So when we talk about omega-3, we're talking about basically EPA, which is eicosapentaenoic acid, and docosahexaenoic acid, that's EPA and DHA. And then the other form is ALA. Mm-hmm. So the benefits, the studies, what the science has shown right now, it is eye health, it is brain health, cognitive functioning, it is heart health, lowering the risk of heart disease and stroke, and it is supporting a healthy baby. Those are the big four. Mm-hmm. Inflammation, maybe, but that's not what all the studies have shown. So we really focus on what it can do for the body. Right. And it's essential. I mean, meaning that our body doesn't make it. We have to get it exogenously. So a lot of people eat fish. Great. That's a great way to get it. Plus you get the protein. However, even if you eat fatty fish 2 or 3 times a week, it's not enough. We really need it daily. And not everybody eats salmon every day. Sounds wonderful, but nah, we're not usually doing that. So we look at supplementation to really help to allow us to be sufficient, so to speak, to make sure we're having enough of that omega-3. So when I said EPA, DHA, the other form is ALA. So somebody might say, I'm going to go and I'm going to buy it. I'll buy a flaxseed oil supplement. That's not the same, because that is primarily ALA. That does not efficiently convert in the body to EPA and DHA. So I think for people that are plant-based, it's very important to realize if you're going to not eat something that has a face or something out of something with a face, you've got to pick algae. That's the form, a plant-based algae form. If you are okay with fish oil or krill, those are the 2 forms. First of all, how much are we looking at? So it's probably a minimum of 500 to 750 milligrams a day of both EPA and DHA. The EPA is more the heart health, the DHA is eye and brain. That's really, and healthy babies. Mm-hmm. That's why we need the combination of both. So when you look at a product, look at the front of the product, and it might say, has 1,400 milligrams of something. Not helpful. You do the flip and read, you turn it over, and you look at the 2 lines, EPA and DHA, and see how much is there. That should be the first thing. You don't need olive oil and a fish oil. That's not what you're buying it for. You don't need motor oil. That's not what you're buying it for. You're buying it specifically for that. And then you have to look at the top at the serving. How many is that? 2, 25. I'm like, oh, fish oil gummies, you need to take 5 of them. That's a lot to take. It's like, wow. And then I think it's important to look at the size, because honestly, with some of them, you need a knife and fork. Right. Yes, like, oh my God, there's the meal, like enormous, like stuck right, trying to get it down. Then we also want to think about third-party verification. And this is really what separates the good from the who knows. So if there's something on the product that says NSF, so that is one that we look at. It's usually a blue stem with orange letters. Yeah. Another one is informed choice. Those are indications that those products actually have in them what they say that they do. And the other one is USP, which is United States Pharmacopoeia. If your product doesn't stay it, put it back on the shelf. So just because you can buy it doesn't mean you can try it. You want to be safe with it. And there also is, well, if it says take 2, I'll take 10 because it's better. No, it's not. That is just excessive. Now, the things that have been said is if you take too much fish oil, it causes bleeding. That really doesn't tend to be true. It isn't. We all need to have enough of it, but we don't get brownie points for taking more than we need. So if you are going to do it, be consistent. I take mine every day, and I have a mini, so it's not teeny tiny, but it also isn't looking like a torpedo. And that's a lot easier to get down. And Is it making a difference? I mean, I don't know. I don't feel smarter, but I don't feel dumber. So I guess that's a good thing. But very important about it. Oh, I could do 𝗂𝗑 6 9. No, it's the 𝗂3. That's what you're buying it for.
Right.
That's the only thing that should be in there.
Right. And especially if you're buying it online, which is what a lot of us do now.
Yes.
It's hard to sift through that because they don't give you all that information. And especially when there's just a lot of ads with it. So you just have to be careful with it. And that's what I wanted you to say, because it's all new to me, looking for NSF and some of the other.
And you look at
labels
the ingredient list, and right now I think another of those darling foods is chia. And I had a chia pet, okay, it's cute with a little green, but like this seems
Most people are old enough that we remember that.
Yeah, remember the chia pet. And the issue here, and there's nothing wrong with chia seed, and you look at it, well, it has 2,500 milligrams of 𝗂3, that's great, but it's a plant. So the form of the 𝗂3 that's in there is the ALA. So yes, you're getting 2,500 milligrams of ALA, but how much actual are you getting in EPA, DHA? About 8% of that. So it's pretty darn low overall. And nothing wrong with eating them, but that's not going to be the best way. So if you like chia seed, do it. If you're not going to eat something that is fish-based, do an algae-based.
Right. All right. Well, there's a few more things I want to go over with you. And I know it's getting kind of long, so we're going to do this in 2 parts. And because I just love to have the time with you, and there's so much good information. So we're going to do this in 2 parts. So once you watch this one, stay tuned for the next one to be published, and we'll let you know when that is.